Hi guys, excuse me, I'm not that tech savvy, so bear with me. I'm going to share my screen with you guys. I hope you guys can see my screen okay. Again, my name is Natalie James, and the drug that I'll be presenting to you today is called carfentanil. The history of carfentanil. Carfentanil is a synthetic drug that was first synthesized in 1974 by a team of chemists at Janssen Pharmaceutica. Carfentanil was created as an animal tranquilizer and was made for large animals. The fact that carfentanil was produced for large animals should give you some idea of how strong the drug is. Carfentanil is 10,000 times more potent than morphine and 100 times more potent than fentanyl. The drug was used in humans for the imaging of opioid receptors. Carfentanil is a Schedule II drug that is taken by injection, inhalation, and also absorbed through the skin. Carfentanil comes in several forms like powder, blotter paper, tablets, and sprays. And the next couple of slides are basically just showing you what carfentanil can look like. It can be brown. Carfentanil can come in a white powder, and it can also come in a vial to be injected. This is what a lethal dose of carfentanil looks like compared to heroin and fentanyl. If you look at the carfentanil, it just takes a little dab for the dose to be fatal compared to heroin and fentanyl. These are victims of carfentanil. This is actually a grandmother. This picture was posted all over social media, all over the news outlets. That's her grandson in the back with his face blurred. They were actually saved by Narcan, but this is what an overdose, a potential overdose of carfentanil can look like. How carfentanil works within the body. Carfentanil is an opioid, and when the drug enters the cells of the brain, it acts in the same manner as the naturally produced opioid in the brain. Opioids produce an intense feeling of sedation and relaxation. This intense feeling of pleasure is what makes opioids so highly addictive. Opioids relieve pain by releasing a large amount of the neurotransmitter dopamine. Carfentanil binds to mu-opioids receptors and acts as a competitive agonist, which means the agonist binds to the same receptors as the antagonist, and they compete for the site. Carfentanil works as an analgesic and a sedative, which gives its user an intense feeling of euphoria. Synthetic opioids affect and makes notable changes to the prefrontal cortex and the medial temporal lobe. Some of the symptoms of opioid use are respiratory depression or arrest, drowsiness, disorientation, sedation, pinpoint pupils, and clammy skin. This image right here is opioid receptors within the brain. Is actually for a medication that actually helps treat opioid addictions, but I chose this image because it actually shows what the receptors look like empty, and it actually shows the opioid and how the opioid actually fits right inside the receptor. And that fit right there is what causes the feeling of euphoria, and it actually helps relieve pain. And this medication, basically, it's blocking the receptor. So I guess the patient doesn't get the full feeling of the euphoria. I guess that's what the medication does. But I just chose the image because it shows the empty receptor, and it also shows the opioid. And unlike natural opioids that actually relieve pain, carfentanil has no medical use for humans at all. Opioid receptors in the brain. When opioids bind to the receptors, the interaction triggers a series of chemical changes within the neurons that lead to a feeling of pleasure and pain relief. The body system affected by opioid abuse. The lymphatic system is a network of vessels through which lymph drains from the tissue into the blood, and the chronic use of opioids decrease the proliferated capacity of the macrophage progenitor capacity of cells and lymphocytes. And when this happens, it can leave the user susceptible to viral, fungal, and parasitic infections. And basically, the lymphatic system is what our body uses to rid us of infections or anything that's not supposed to be there. That's what the lymphatic system, that's what the lymphatic system does. It helps clear our body from all of that. And this basically is what the lymphatic system consists of. You have the lymph nodes, you have lymph nodes behind your ears, you have lymph nodes underneath your neck. This also shows the bone marrow, the spleen, all those things in the body that help us fight infection. And opioid abuse just depresses that system, and our body is not able to fight off the infection. This is death by carfentanil. In 2015, there were no confirmed deaths by carfentanil. In 2016, that rose to 56. And in 2017, it was 191. That dropped in 2018 to 24, and then up again in 2019 to 220. So it's definitely a drug that's on the rise. Overdose rates for opioids. By June 2021, synthetic opioids were involved in an estimated 87% of opioid deaths and 65% of all drug overdose. I hope this was informative. I hope you guys learned a lot, and I hope I didn't forget anything. Thank you guys for listening.